The first thing that Dr. Chism's counseling session, in effect, had on me was to bring me to happiness tears that somebody understood me.
At Karmanos Cancer Institute, we care about treating your cancer, but we also care about your quality of life. Many cancer treatments can greatly impact a woman's quality of life by either inducing or worsening menopause symptoms, and cancer treatments can also impact a woman's sexual health.
I had my ovarian cancer surgery in 1999. I began to notice the menopausal symptoms about 5 years after my surgery. By the time I talked to Dr. Chism, I was having a very noticeable hot flash, maybe every hour.
I started noticing menopausal symptoms about 3 months after I started chemotherapy. So I was only 29 years old and I started having hot flashes. And when chemotherapy ended, I immediately was put on endocrine therapy to suppress my ovarian function because my cancer is hormonally driven. So then I started having additional symptoms too. So it's been now 4 years pretty much nonstop that I've been having these symptoms.
I was recommended to Dr. Chism by the Waltz Breast Cancer Center at Karmanos for menopausal reasons over a procedure I had. I needed to see her, and I found out so much information on dealing with my menopause.
At Karmanos, we have a clinic dedicated to educating and counseling women about safe modalities to help them with their menopausal symptoms. Safe modalities that may be talked about and suggested include non-hormonal medications and supplements that may help reduce hot flashes, sweats, and irritability. We also counsel women about possible products that may help them with their symptoms, such as Chillo pillows, menopause sheets, menopause pillowcases, menopause pajamas, and cool-off towelettes.
Dr. Chism recommended a medication, a type of antidepressant, that they were recommending for postmenopausal symptoms, primarily hot flashes. It worked very well for me. Other antidepressants caused me to be very sleepy, but the antidepressant she finally recommended was very effective without side effects.
She talked about just different things that might make the menopausal symptoms or hot flashes worse. Certain, like alcohol or caffeine or things like that, and just gave overall education about what could make that worse or better. I think meeting with Dr. Chism was huge. I went from feeling exhausted all the time from not sleeping through the night because of my night sweats to finally, after probably 2 years of not sleeping, finally being able to sleep through the night completely.
She recommended stay active, don't rest during the day a lot, try to eat a lot of fruits and vegetables, try to not take naps during the day so you can sleep at night. She recommended websites where I can buy clothing to help me stay cool for the hot flashes, all different kind of little products you can buy to help you with the menopause and the hot flashes.
Cancer treatments may also impact a woman's sexual health. Women may experience changes to their vagina, which may include decreased lubrication and or pain with intercourse. Women may also experience decreased interest in sexual activity.
I had difficulty with sexual health. The first thing was that when I walked, it hurt. When I had multiple bladder infections, yeast infections, and sexual intercourse was very painful.
We talk to women about medications that may improve their vaginal health and improve vaginal lubrication and decrease pain with intercourse. We also talk to women about therapies and techniques that may improve their decreased desire for sexual activity.
The first thing Dr. Chism recommended was a Dhea Suppository, which I inserted in my vagina on a daily basis. It was so effective that it just took away all of my symptoms. It took away my bladder infections, it took away my yeast infections, and it took away painful sexual intercourse.
She offered information about different products to try for the dryness issues or different strategies for the libido. So she had a lot of knowledge and was very open and easy to talk to about that kind of thing, which I think is rare to find in your healthcare practitioners.
Dr. Chism made me feel so comfortable in discussing my sexual issues, and I carry her business cards with me all of the time and give them out to my friends and people I meet
For a lot of women going through this, we just think that we have to put up with these issues and that we'll just deal with it. But I realize that it does make a big difference to see her and to try to get some assistance for this kind of thing.
She's A1. My transition went very comforting with her, very comforting.
So to find someone that was so knowledgeable about it and had some good strategies and ideas for me was really important for me to continue to see her. And I have recommended her to other women too.